Good morning, everyone. The syndrome I have is the Angelman syndrome. It's a severe neurogenetic disorder, and it shares symptoms and characteristics with those of autism, cerebral palsy, Prader-Willi syndrome, and for this reason, it may be often misdiagnosed, which would obviously cause, if it's misdiagnosed, it would cause issues such as early intervention programs and resources are not being used for the child with the Angelman syndrome. Characteristics of this disorder include developmental delay, there's a lack of speech, they may have seizures, and walking and balance disorders. However, these children are very happy, they frequently laugh, smile, and they're very excited all of the time. In infants 0 to 24 months, you'll notice that they may not coo or babble, they may not be able to support their head, pull themselves up to stand, or they may have delayed motor skills. In younger children, there's a lack of speech, though at some point in their lives, they may be able to develop the ability to speak a few words. They have a delayed ability to walk, and they may have balance issues. Some of the online resources are here. So there's AngelmanPart1, then there's Angelman Canada. The Mayo Clinic was really helpful for basic complications with the Angelman syndrome. And then there's another one here with regards to what the condition is like and how we can handle it. Some of the causes, so everyone has two number 15 chromosomes. One is from the mother and one is from the father. So there are different reasons as to why this chromosome causes Angelman. A blood test can detect up to 80 to 85% of individuals based on the gene. So it could be that there is a chromosome deletion, so 70% of people have that. Less than 5% have inherited both number 15 chromosomes from their father instead of getting one from each parent, and that can also cause AS. Less than 5% have an imprinting defect. 10 to 15% have some sort of DNA alternation, and in the rest, a blood test or diagnosis cannot be done, so it's a clinical diagnosis that is done. AS is named after a British pediatrician. This is Dr. Harry Angelman, who first described the syndrome in 1965. Originally, it was named the Happy Puppet Syndrome, but the term was obviously considered stigmatizing and is no longer accepted. AS occurs in 1 in 15,000 births. It's considered a very rare neurogenetic disorder and occurs equally in both females and males and in all races. With regards to medical information, the individuals with the syndrome will require lifelong support. They still tend to live a normal lifespan, but with this lifelong support. The syndrome usually isn't detected until parents begin to notice developmental delays when a baby is about 6 to 12 months, and that would be with regards to the cooing, the babbling, unable to support his own head, unable to sit up, that sort of thing. The seizures will begin around age 2 to 3, and they'll continue throughout adolescence and into adulthood. As adults, they may become less excitable and they could develop sleep problems. So some support for parents, there is the link here, AngelmanBehaviors.org, where it's going to display the different behaviors that people with AS will display. They also can go through modules for their behaviors. So depending on their struggles, if their child has a communicative behavior, they seem to be displaying some aggression, cognitive issues, sensory development, parents can go through and there's modules that will provide them with information regarding each of those issues. The Parent Educational Advocacy Training Center also developed an IEP checklist for an iPhone app to help parents of students with special needs become better informed about the IEP process. This was mentioned in my research for AS, but I think it would be able to be used by many other parents with regards to the IEP process. Educational information, so there are webinars available on the organization website. So that would be the AS website for resources, communication, training series. There's also a discussion of the expectations that teachers should have for students with AS. And this was actually a really great site. So if you expand all of them, intellectual abilities, So developmental testing may be difficult because of attention, activity, speech, and motor issues. So we have to provide some sort of accommodation based on that sort of thing. Standardized and formalized testing is very limited. So we have to provide them some sort of other assessment methods because of the testing issues. So this website actually helps teachers mostly to illustrate the things that we can do. So behavioral information, as mentioned, they will have seizures. They'll have stiff or jerky movements. They may have a small head with a flatness at the back of the head. They may thrust their tongue. They have light pigmentation in hair, skin, and eyes. They'll have unusual behaviors such as flapping of their hands and arms uplifted when they're walking. Complications. So there's feeding disabilities because they cannot coordinate sucking and swallowing. They may have to be fed in different manners. They have a short attention span, so they always need to be kept busy, which is important to know for our classroom. They have sleep disorders, so abnormal sleep-wake patterns. They need less sleep than normal, but this can change when they get into adulthood. They may have a curving of the spine occur over time, and obesity. They tend to have larger appetites, which may lead to obesity. Community support, there are no official community supports for AS that I found in my location for Guelph. There is a reach out to the Ontario Association for Families with Communication Disorders, which can help parents find support for the language services, obviously because they're unable to develop all of their speech. There are also many ways to fundraise to parents with AS, as the students and their children will need lifelong care. There are no schools or facilities currently to provide this care. Families are going to have to pay a lot of money to find their own lifelong care. So donations can be given at the CanadaHelps.org charities. Inclusivity in education. So these students can do well in regular classrooms when they're provided with support. So we're probably looking at one-on-one support from an EA. Therapies, if possible, should be included in the regular school setting as it provides greater learning opportunities. And I will touch base on that a little later. It is very important that children with AS be able to make authentic choices in the classroom and life. So sometimes when we find that a student is nonverbal, at least in my own experience, I've noticed that we talk down to them. They're not able to make decisions without almost sounding like we're ordering them around. So they need to be able to make authentic choices in the classroom. If they are unstable or are not walking, they will obviously require physical supports in the classroom, so that could mean a wheelchair. Flexible groupings will also provide extra support required in their academic programming. Social skills, numeracy, and literacy training. So the social skills is a huge one for AS. They need to maximize their potential as oral speakers by using strategies to improve oral control. Incorporate their peers into the therapy as much as we can to promote social interaction and provide models of language. Use picture cards and communication boards early on. So these should even be used by the age of 3, 4. They pay more attention when they are naturally curious. So allowing them to explore with math tools will persuade them to remain interested. You can do this with science and other items as well. So the use of technology, I suggested the use of an iPad because one of my students is nonverbal. Obviously computers and manual sign systems, ASL, CE. There's also an AAC system, and this is explained here. So it's all forms of communication, not just oral speech, for expressing thoughts, needs, and wants and ideas. They're typically used for children or adults who cannot use speech to communicate effectively in all situations. So they rely on the user's body language to convey messages. Workplace skills training. So again, the focus on social interaction to ensure it is natural and functional in the home environment, extracurriculars, and the classroom. Here at my school, I would suggest that they're placed into a co-op program, perhaps at a grocery store where they can develop these social skills, develop fine motor and oral motor control through occupational therapy, and help with proper positions, hand use, and communication needs. Some of the cautions for us as educators. So all of our areas in the classroom and schools need to be safe and it should not say full of obstacles, free of obstacles when working with the student. Imitation can be difficult for these students, so they cannot learn by imitation.